You're journaling, you're meditating, you are trying absolutely everything to force those positive thoughts, but you still wake up feeling completely exhausted. So why do you still feel stuck? Well, let's just validate that right out of the gate. It is incredibly frustrating when you feel like you are doing all the quote-unquote right things, but you aren't seeing any real lasting change in your day-to-day life. Look, you are definitely not alone in this, and it absolutely doesn't mean you're broken. Honestly, a huge reason we stay stuck is just the system itself. It is a total mental health maze out there. It's confusing, it's overwhelming. You finally make the brave decision to get help, but then who do you even call? A counselor, a psychologist, a psychiatrist? Just trying to figure out exactly what kind of professional help you actually need is honestly enough to make you want to just close your laptop and give up on the whole thing. But here's the part most people get wrong, and this is a real game changer for how we approach getting unstuck. See, we often think we have to choose just one path, right? Just pick one specific door and cross our fingers that it's the right one. Okay, let's clear this up and dive right into the difference between a therapist and a psychiatrist. Demystifying these two roles without all the heavy medical jargon is literally your first step out of the maze. The truth is, these professionals are not competing for your time. They aren't competing for your treatment. They are entirely different tools, and they're actually designed to build the foundation of your recovery by working together.
Let's look at the psychiatrist first. I want you to think of a psychiatrist as the doctor who treats your brain's weather system. They are highly trained medical doctors. If there is a massive biological or chemical storm raging in your brain, we're talking severe depression, intense panic, crippling anxiety, they manage that weather. They often use medication to clear the storm just enough so you can actually function and establish a solid baseline of stability.
Now let's bring the therapist into the picture. If the psychiatrist is managing the weather overhead, the therapist is down on the ground building the mental roads. A therapist acts as your personal guide. They help you navigate the tricky, bumpy terrain of your life, process the heavy stress you're carrying around, and build long-term resilience and daily coping habits. Basically, they teach you how to drive safely no matter what the weather is doing outside. Think of it like this. It's the cast versus the rehab. Imagine you have a broken leg. You wouldn't just jump right into physical therapy on a completely shattered bone, would you? No way. You need a cast first to stabilize it. Medication from a psychiatrist acts exactly like that supportive cast for your brain. Talk therapy is the physical rehab you do afterward to regain your strength and learn how to walk on your own again. So, the absolutely crucial takeaway here is that combining both of these approaches is widely considered the gold standard of care, especially for moderate to severe conditions. Why? Because the medication manages those intense physical, biological symptoms, which finally gives you the stability and the focus you need to actually do the hard work in therapy. To put that into perspective, check out this number: 80%. In one major study looking at older adults with depression, 80% of the people who received this combined care, so both medication and therapy, managed to avoid a relapse. Now, compare that to just 57% of people who only took medication. Combining the cast and the rehab is incredibly powerful. But you might be wondering, what happens when you've been talking for months and nothing changes? It is completely disheartening. You pour your heart out week after week, you're doing the rehab, and you still feel like your tires are just spinning in the mud. So what exactly are you supposed to do if you hit that frustrating plateau?
If that sounds familiar, you need to know about the 8 to 12 week rule. If we've been putting in the real work in therapy for 2 to 3 months and there is absolutely no meaningful progress, listen to me, you haven't failed. Therapy hasn't failed. What it is a massive signal that an underlying biological factor might be the roadblock here. Your brain chemistry might literally be preventing you from using those great coping skills you're learning. That is the exact moment when it is time to seek a psychiatric evaluation to get that cast in place.
And then, once that biological baseline is stabilized, we get to shift our focus to building your everyday toolkit. See, modern therapy isn't just about laying on a couch and venting about your week. It is about acquiring actual, evidence-based life hacks that you can use every single day. Let's break down a few of the most effective tools out there right now.
First up, we have CBT, which stands for Cognitive Behavioral Therapy. But let's look past the clinical jargon for a second. CBT is really just a highly practical method for re-architecting your mind. It's a structured way to systematically rewire those inaccurate, totally pessimistic beliefs you hold about yourself. You know, the ones constantly whispering that you aren't good enough or that everything is absolutely going to fall apart.
The CBT playbook is super actionable. Step 1, you identify those negative beliefs. Step 2, you stop the avoidance behaviors that are secretly reinforcing your negative feelings, like, say, canceling plans at the last minute because you feel anxious. And step 3, you do the homework. Yes, actual homework. CBT requires active participation between your sessions, like keeping a thought journal, to truly break and change those dysfunctional patterns.
But hey, what if you have absolutely zero energy to even think about your thoughts? Enter BA, or behavioral activation. This is literally the ultimate life hack for when you are totally devoid of motivation. The core rule here is incredibly simple but wildly powerful: acting before you feel.
What's really fascinating about the BA playbook is that instead of trying to fix your thoughts, you focus entirely on your behaviors. You force yourself to replace passive negative habits, like scrolling on your phone in the dark for 3 hours, with active ones. By literally forcing your physical body into action, you jumpstart your mood. You don't sit around waiting for motivation to strike, you create it through action. Finally, we have IPT, or interpersonal therapy. Think of this one as fixing your relationship architecture. This is the main tool you'll pull out of your kit when your mental health struggles are heavily rooted in your external social environment. We're talking things like constant conflict with a partner, deep grief, or trying to navigate a massive life transition. The IPT playbook usually spans about 12 to 16 sessions. You and your guide will work on identifying your specific relational triggers, dramatically improving how you communicate what you need, and building much healthier ways to resolve conflict with the people around you. Because the reality is, when your social environment is healthier, your mind naturally follows suit. Okay, we have covered a lot of ground today, and I really want to reassure you, you do not have to fix everything all at once. Getting unstuck is not about making one massive, terrifying leap. It is simply about focusing on small, manageable wins. It's about stacking those tiny victories over time, building up your personal toolkit, and just knowing when to ask for the right kind of help.
And the best part? You really don't have to navigate this maze alone. If you live in Ohio, Providers for Healthy Living is a collaborative partner ready to help untangle all of this for you. Check out www.providersforhealthyliving.com. We absolutely invite you to reach out to us for exactly this kind of coordinated, accessible care. Whether you need a therapist to help build your everyday toolkit or a psychiatric provider to help stabilize the weather, we are right here to help you.
Please note, this explainer is for educational purposes only and does not substitute for professional, medical, or mental health advice. Please consult a qualified professional for diagnosis and treatment. If you or a family member are in immediate crisis, please call a crisis hotline, dial 988 in the U.S., call 911, or go to the nearest emergency room for assistance. Remember, the ultimate goal is just small, manageable wins. Take that very first small step today. If you found this explainer helpful in untangling the mental health maze, please hit that like button, share it with someone in your life who might be feeling stuck right now, drop a comment below about which part of the toolkit resonated with you the most, and of course, subscribe for more. So, as you look at your own mental health journey today, I want you to ask yourself, what is one passive habit you can replace with an active step right now to finally start moving forward?